than ever before. Is there any understanding of why that's happening?
There are some thoughts about it, but not much understanding. Unfortunately, we don't have complete understanding, and I don't think we'll have it for a while. It's a very, very difficult area to figure out why certain amount of abnormalities in one man can cause a problem in another man that would not. Why? Probably because the major part of having accelerated development of cardiovascular disease lies in stress and sedentary lifestyle. And more young women are exposed to very high stress at work, at home, living as single parents, for example, or taking over the quite demanding jobs, and on the top of not having time to exercise. And
well, how important is exercise? And what kind of exercise should a woman be doing?
Exercise is extremely important. It's a single most important, in my opinion, part after the genetic predisposition, which is modifiable. I mean, genetic predisposition, of course, not, but it's a single most important modifiable part. You can potentially decrease risk of cardiovascular disease and death by 50% just by doing simple exercise 20 minutes a day.
Okay, so what is that simple exercise? Let's give our viewers an idea of what they should be doing.
It should be exercise. It should not be just walking or having like quite energetic movements at work, for example. It's not that. It has to be level of aerobic physical activity which raises your heart rate to a certain level, aerobic level, which is usually between 50 to 75% of predicted maximal heart rate. And the simple formula to count it is you have to reach the level where your heart rate is 160 minus age, approximately.
And how long should somebody be doing this?
For about 20 minutes. And this is, of course, only after discussing it with your doctor and obtaining clearance from the healthcare professional. But 20 minutes on 5-6 days a week had been shown to decrease risk of heart disease by 50%.
And if someone doesn't have that much time, can they do it for less?
They can do it for less, but then you don't have such a great benefit. But again, if you don't have 20 minutes, you can do 10 minutes in the morning, 10 minutes at night.
So people can break it up that way. It's okay.
Absolutely. You can break it up in 5 minutes, 4 times a day. And that's the beauty of it. It's really not demanding, and it's just very simple. So there's some misconceptions and myths which circulating because people think that first of all they don't have time, and as we discussed, it's really not an issue. Number two, they think that they will be tired after exercise and they will not be able to perform their regular duties, and this is also not an issue because most of the time people feel much better and much stronger after exercise. There are some myths that they have to be athletic. No, everybody can do it. So there is no excuse. Everybody should exercise at least for 20-30 minutes a day. If you'd like to lose weight with exercise program, it's also possible, but then you have to increase it to about an hour a day. About 20 minutes, 30 minutes a day.
So diet and exercise are probably the most important things that somebody can do on their own.
Yes, I think exercise are even more important than the diet, because with exercise, even if you're not following the diet very well, you can change the ratio of good and bad cholesterol in your blood, and this way you can tremendously decrease your chances of developing heart disease. And as I said, unfortunately 50% of women die from heart disease, and in almost 50% of the cases, the first sign of let's say heart disease is a deadly heart attack. So we don't have time.
Now, heart attack, I've also read that lately research has shown that the symptoms of a heart attack is different for a man than it is for a woman. What are the symptoms?
There are. Classic symptoms of heart attack is feeling of burning sensation behind the sternum, pressure, pain, sometimes radiating to the left arm, and this accompanied feeling of being sick, covered with cold sweat, short of breath, and so on. In women, it is still prevalent, but and many more percentage-wise, they experience unusual symptoms, such as just feeling very tired, weak, short of breath. Most common symptom which I encounter in women who present with the typical symptoms is shortness of breath and physical exhaustion without any pain. So if that's what somebody is experiencing, they immediately have to discuss it with a doctor. And there is tremendous development in our dealing with heart attacks. So doctors have a lot of tools of preventing and treating.
So that would be the medications to lower cholesterol or to lower blood pressure.
In prevention of heart attack, I think by the level of importance is exercise, diet, and then regular checkups with your doctor. And doctor has the tools of decreasing your chances of developing cardiovascular disease, heart attacks, and strokes. And they are decreasing cholesterol, improving ratio between good and bad cholesterol, decreasing certain other substances in the blood, such as, for example, treating people with diabetes, which is by itself tremendous problem also, and becomes more and more, unfortunately, prevalent in our society because of diabetes.
Heart disease, though, is more than just a heart attack. There's
heart disease is you can divide it into two big categories. It's a disease of the heart vessels, which is what we call coronary artery disease, when they are covered by the plaques and they do not function as vessels for the blood supply. And the second big part of heart disease is the disease of the heart muscle, when people develop so-called congestive heart failure or cardiomyopathies, and they can be related to coronary artery disease, but the idea is that the heart doesn't contract very well, as opposed to developing heart attacks.
What questions should a woman ask her doctor when she pays him a visit?
In terms of what? In terms of prevention of cardiovascular disease? Well, first of all, I believe that doctors should do more asking, but we have to figure out most important things, which is, number one, genetic predisposition. Did anybody from the family suffer from the heart attacks prematurely in a young age, which is very, very important to find out. Are there any unusual symptoms which women are experiencing? For example, did she have shortness of breath when she is walking? Did she have any sensation, substernal pain, or burning sensation during exercise? What is a habit of exercise or diet and so